Hello everyone, welcome back to my channel. I am Dr. Soumita Roy and today we are going to discuss a very important topic for your exam, that is febrile seizures. So what is febrile seizures, students? You see, any seizure in age group of 6 month to 60 month, okay? Make it very clear. 6 month to 60 months. The peak age is 12 months to 18 months. Okay. With fever, that is temperature more than 38 degrees Celsius or more than 100.4 degree Fahrenheit. Okay. And without any evidence of CNS infection or electrolyte imbalance, okay, and provided that the child did not have any previous history of febrile seizures. That completes your definition of febrile seizure. Clear? So again, do not miss this particular points: the age group 6 month to 60 month, peak age group 12 month to 18 month, and fever is more than 38 to more than 100.4 degree Fahrenheit. Okay, now what are the types of febrile seizures? So basically, there are mainly two types. One is simple febrile, okay, and the other one is complex febrile. You will be asked each of the criteria of simple and complex, okay. So what is simple febrile? If the duration of convulsion is less than 15 minutes, if the type of convulsion is generalized, and more commonly it is tonic-clonic, okay, and it won't recur, okay, won't recur within 24 hours. Of course, it will be associated with fever, does not need to be mentioned, okay. And generally what happens is the post-ictal phase is very short, okay. The child becomes very playful just after the episode. Done. So that is all about your simple febrile convulsion. Next is the complex febrile convulsion. So see students, again very easy. The episode will be more than 15 minutes, okay. So here what did I say? It will be generalized tonic-clonic, okay. So here it will be, of course, focal, and it is going to recur within 24 hours. And there is also something called status febrile epilepticus. So what is that? If the seizure goes on for more than 30 minutes, so then you will stamp it as status febrile epilepticus. Clear? So next, moving on to a viva question, that is, what are the risk factors for recurrence of febrile seizure? Okay, so there are few major as well as minor risk factors, okay. So what are the major risk factors? If the age of the child is below 1 year, clear. If the temperature ranges from 100.4 to 102.2 Fahrenheit, okay, and if the seizure occurs within 24 hours of fever. So that is these are the major risk factors for recurrence of febrile seizure, okay. Then what are the minor risk factors? if there is family history of epilepsy, okay, if there is family history of febrile seizures, done. If it is not a simple febrile, if it is a complex febrile, that is also a risk factor, okay. If it is a male child, see student, very important, if it's a male child, then also there is a high chance of getting recurrent febrile seizure, okay. Next is, if the serum sodium level is low at the time of admission, then these are the risk factors for recurrence of febrile seizure. Clear? Next, moving on to the genetic aspect. So yes, students, there is a genetic predisposition for febrile seizures. Okay, you need not know all, just remember this is a polygenetic one, okay, polygenic one, and the genes involved are, it's important only for MCQ, SCNA1, 2, okay, these, okay. Well, so next, how are you going to evaluate a case of febrile seizure? Very important, comes as long question also. How you are going to evaluate? So suppose a child has come, what do you mean by evaluation? When a child is presenting to you with febrile seizure, what are the investigations you should do? Okay, so there are lots of controversies regarding investigation of febrile seizure, okay, namely the first one is LP. Are you going to do? Well, I'll be telling you later on. Next is the EEG, okay, followed by neuroimaging, okay, and last but not the least is the blood parameters. Okay, so see students, everywhere I have kept an interrogation mark. So there are no certain indications that you have to do LP, you have to go for EEG, you have to go for neuroimaging, or you have to do blood parameters. Basically, a case of simple febrile seizure doesn't require any investigation. Clear? You just need to find out the focus of infection, okay. Majority of the cases are secondary to some viral infections, okay, namely HHV6, 7, okay, and few are definitely secondary to some bacterial infection like E. coli, Shigella, and so on, okay. So when are you going to do LP in case of febrile seizure? If if you are suspecting meningitis, if you are not being able to rule out meningitis, okay, definitely you are going to do a CSF analysis, okay. Any child below 6 months presenting with fever, with convulsion, you should definitely go for LP, okay, without a second thought, okay. And for 6 to 12 months, if the vaccination status is unknown to you, okay, what are the vaccines you should look for in this case? Yes, of course, it will be H influenza and streptococcus pneumoniae, right? So then you are going to do LP, okay. Next is the EEG. Are you going to do EEG in a case of simple febrile convulsion? Of course not. So you will be doing EEG only if you are suspecting it to be a case of epilepsy, okay. Or in case of complex febrile seizure, you may do EEG, but that should be done after 14 days, okay, not before that, okay. Next, neuroimaging means MRI or CT brain. Are you going to do? Again, of course not in case of simple febrile, okay. If you are thinking of some other infections or the seizure is due to some secondary to some brain malformation, then only you are going to do neuroimaging. Okay. And if in the case of febrile seizure or a complex febrile seizure, if you are doing MRI, students, you are just going to get what? Swelling near hippocampus. Okay, clear? Next up, blood parameters. Again, need not to be done in a clean case of clear-cut case of simple febrile seizures. But if you are doing, you should definitely send serum electrolytes, namely sodium, potassium, calcium, magnesium, phosphorus. Okay, and you should definitely order one blood glucose. Done. So this ends your evaluation. Next, moving on to the most important and the last part of this lecture, that is how are you going to manage a case of febrile seizure. Well, so in treatment, first thing is you are going to take a proper history. Okay, then you are going to examine the child thoroughly by doing a general survey and neurological examination. Clear? Then you are going to treat the child. So how you are going to treat the child? Yes, if the child is coming to you with active convulsion, okay, then you are going to maintain ABC. All of you are knowing, maintaining airway, breathing and circulation. Okay. Next, you need to abort the convulsion. Okay. By what? By either you can give lorazepam IV or midazolam. Okay, or diazepam. Clear? So dose, if you want to know, definitely very important for PGs, but for UGs you may skip. But if you want to know, then okay, good to know. It is 0.05 to 0.1 milligram per kg per dose. Okay, this is 0.2 milligram per kg per dose, can be given IM, and intranasal spray or buccal formulation of midazolam is also available. Okay, diazepam you may give rectal. Okay, well, so after this, of course, you have to give antipyretics. What is that? Namely, all of you are knowing paracetamol. Okay, and of course, you have to do sponging. Okay, and very important thing is parental education. Okay, you need to assure the parents that okay, if your child is having a simple febrile convulsion, then nothing too much to worry about. Okay, and there is no role of giving any prophylactic anti-epileptic drug in case of febrile seizure. Okay, like historically it was given, phenobarbital, valproate. So now it's not recommended, not needed. Done. So one thing, students, febrile seizures are generally benign. Why? Because in long run, it doesn't hamper the scholastic background of the child. Okay, it doesn't hamper the IQ. Okay, it has got nothing to do with the neurodevelopment of the child. Okay, and nothing to do with the cognitive part of the child. So these are the things which you should convey to the parents. Okay, so I think that's all about febrile seizures. So I guess this was helpful to you. So we'll be again meeting soon in our next video. Thank you.